You just had a baby. Everyone around you is celebrating. Your family is telling you this is the happiest time of your life. And you are sitting there, exhausted, lost, feeling nothing you are supposed to feel, and wondering what is wrong with you. Nothing is wrong with you. What is wrong is that nobody told you what actually happens to a woman's brain after she gives birth. Hi, I am Dr. Sunaina. I am a gynaecologist with over 12 years of clinical experience. And today I want to talk about something that is consistently overlooked, not just by families, not just by society, but often within medical training and clinical practice itself. Postpartum depression. Not as a label, not as a stigma, but as a biological event that happens to real women. And that is nobody's fault. To understand why this happens, you need to understand what occurs in your body in the first 72 hours after delivery.
Throughout your pregnancy, your placenta produces enormous amounts of estrogen and progesterone. These hormones don't just support the pregnancy physically, they have a direct, calming, stabilizing effect on your brain. Your nervous system for 9 months has been chemically supported. Then the placenta is delivered, and within 72 hours, estrogen and progesterone levels crash rapidly, dramatically. The calming support to your brain is gone almost overnight. Your brain is, in a very real sense, in withdrawal.
At the same time, you are sleep deprived, physically recovering from either a vaginal delivery or a major abdominal surgery. Your body is producing milk, and you are responsible for a completely dependent newborn human being. This is not a recipe for happiness. This is a recipe for neurological and physiological crisis. And yet, we hand women a baby and expect them to feel joy.
Now, not every woman who feels low after delivery has postpartum depression. There is something called baby blues. Baby blues affects up to 80% of women in the first 2 weeks after delivery. Tearfulness, mood swings, anxiety, feeling overwhelmed, it resolves on its own. It does not significantly impair your ability to function. It needs support, not treatment. Postpartum depression is different. Postpartum depression is a major depressive disorder. It causes moderate to severe functional impairment. It does not resolve on its own. It needs both psychological support and, in many cases, pharmacological treatment. The clearest distinction I give women in clinic is this: baby blues, you feel fragile, but you can function. Postpartum depression, you feel lost and you cannot function. The suffering is not a matter of degree. It is a different condition entirely. And the window matters. Baby blues, first 2 weeks. If you are 4 weeks postpartum and you still feel this way, this is not baby blues. Please do not wait for it to pass on its own.
Now, here is the gap between what people imagine postpartum depression looks like and what I actually see in my clinic. People imagine a woman who is visibly crying, unable to get out of bed, clearly falling apart. What I see is a woman who looks exhausted and lost, who is doing everything: feeding the baby, managing the household, receiving visitors, but whose eyes are hollow, who describes her days in logistics, not feelings, who, when I ask her how she is feeling, not coping, feeling, goes quiet. And when she does speak, she doesn't say I am depressed. She says, I can't sleep, and because I can't sleep, I don't have the capacity to take care of my baby. And then I can't take care of myself either. She frames her suffering as a practical problem because nobody has given her the language for what is actually happening. And underneath all of it is guilt. The guilt of not feeling happy, the guilt of feeling detached from her baby, the guilt of struggling when everyone around her is celebrating. That guilt is not a character flaw. That guilt is a symptom.
So, why does this get missed? Because of a single devastating cultural message. This is normal. You should feel happy. If you don't, something is wrong with you. So, women do not come forward. They carry it. They perform okayness for their families.
They put the baby first, which sounds selfless but is actually dangerous. Because a mother who is neurologically and emotionally depleted cannot bond properly with her baby. The mother baby relationship, the attachment that shapes that child's emotional development for years, depends on the mother being okay. This is not selfish, this is biology.
And I want to say something specifically about who is at higher risk because this is not random. If you have a history of depression or anxiety before pregnancy, your risk is higher. If you experienced severe stress during your pregnancy, be it financial, relational, family, your risk is higher. If you have little or no support system around you, your risk is higher. If any of these apply to you, please do not wait to see if it gets better on its own.
Let me tell you clinically what postpartum depression does to a woman's body and brain when it goes unrecognized and untreated over months. Because this is not just about feeling sad. This is about a progressive neurobiological deterioration that affects two lives simultaneously, the mother and the child she is trying to care for. Maternal self-neglect deepens. Nutrition, hydration, basic physical recovery all compromised. The mother-infant attachment bond, which is not just emotional but neurobiological and which directly shapes the infant's developing stress response system and long-term emotional regulation, begins to deteriorate. We now have research showing that impaired maternal bonding in the first months of life has measurable consequences on the child's neurological development years later. The mother's depressive episode lengthens and deepens. Anhedonia sets in, that is, the complete inability to feel pleasure or connection, not just with the baby but with everything. And in a subset of women, passive thoughts of self-harm emerge. Not necessarily active suicidal ideation, but a quite frightening wish to not be here anymore. I'm not telling you this to frighten you. I'm telling you this because this is a medical condition with a trajectory, and that trajectory is interruptible. Every intervention, early intervention, changes outcomes dramatically. I want to address something directly because I know the reality of what stops women in India from seeking help for this. The stigma around mental health, the fear of being sent to a psychiatrist, the family saying, just rest, you will be fine. Everyone goes through this. So here is what I want you to do. Not a psychiatrist first, not if that feels impossible right now.
Go to your gynecologist. Your gynecologist delivered your baby or managed your pregnancy. She knows your history. She can take a proper history not just of your physical recovery but how you are actually feeling and functioning.
She can screen you properly. She can refer you, if needed, to the right person with context, without judgment. That first conversation with someone who already knows you medically is the lowest barrier entry point into getting help. And to the families watching this, when a new mother in your house says she's struggling, please do not tell her this is normal. Please do not tell her the baby needs her to be strong. Ask her how she is feeling. Take her to her gynecologist. That one act could change everything for her. The goal is not to medicalize motherhood. The goal is to end the silence that makes women suffer alone. Postpartum depression is not weakness. It is not bad motherhood. It is a biological event triggered by the most dramatic hormonal shift the female body ever experiences, happening inside a woman who is already exhausted, already giving everything, and already being told she should feel grateful. She deserves better than silence. You deserve better than silence. Your body has a logic. This channel exists to give you the language for it.